name's Tom Stewart and I'm a laryngologist, which is the ENT subspecialty involving care of voice, airway and swallowing disorders. So in our practice, we need to measure patients' subjective outcomes and changes over time. And this is not something that I can tell a patient. I'm really interested in what their symptoms are. And so across our specialty, what has been developed and validated over a long period of time are a whole range of different patient-reported outcome measures, which we refer to as PROMs. And so what we've developed in our practice is the ability for a patient to have these questionnaires answered easily online before they come and see us. And this will automatically populate in our computer system so that when the patient comes in to see us, we can see quickly what their most recent scores are for these different parameters of particular conditions or symptoms. And this is highly valuable for the patient. It means that over time they get to track their progress and we get to try and objectify their symptoms and track whether there's an improvement or deterioration or plateauing in their function. And also it saves them time so that in the practice, when they're seeing us, we can talk in more detail about their concerns or their problems or things that they wish to ask, rather than spending the majority of the time answering a standardized pro forma questionnaire. So we find it invaluable. It saves us time, it saves the patient time, and it's a really nice, efficient way to also record the information in a standardized way, rather than having bits of paper and uploaded PDFs and finding it difficult. We used to find that the autofill PDF documents are really quite cumbersome and difficult to manage. We've set up the process ourselves and it's been quite involved to do, but the concept of a PROM is simply a patient-reported outcome measure that can be useful for any particular condition, even as a quality improvement project for talking about the patient's experience in a practice, or anything really. And the benefit of it is clearly just in the fact that it's the patient defining what their responses are. In terms of developing the process, I think different practices will do it in a way that suits them. We found this automated process online very useful for us. And I think they're becoming more and more useful in certain subspecialties like ours, where we don't have as many objective findings. For example, it's not as simple as having an X-ray with a clear demonstrated fracture where you can rely upon a report. And the report is essentially an objective result. We have a lot of interpretation and this is really useful in that setting. So they've been around for a very long period of time, but in terms of their robust nature and validated utility, they're becoming more and more important. I think our patients particularly like the simplicity of doing things online and not having to use up a big component of their appointment time filling out a questionnaire that is a simple questionnaire but does take time. And so they find the efficiency of the way that we've set it up really useful. I mean, I think that in terms of interpreting the data, that's what we find most useful. We can then feed that back to the patients about whether things are improving or deteriorating. But it's really nice when a patient, for example, let's talk about their voice handicap index, which is a measure of vocal dysfunction. It's a scale where patients report the degree of dysfunction that their voice is having in certain scenarios. And they might find that they're getting frustrated and they don't feel they're making the degree of improvement they thought they might be. But we can, having tracked this particular VHI score, we can say that actually this is getting quite close to what is considered to be a normal value. And that can be quite a reassuring external assessment for the patient.